Here is the summary on the chapter on prosthetic valves. There are several types of valves: mechanical, biological, homo, and autografts. The biological valves have the advantage that they do not need anticoagulation, while the mechanical valves are more durable. The valves have typical flow patterns, and mechanical valves also have what we call normal physiologic regurgitation. Echocardiography always allows us to differentiate between mechanical and biological valves, and it is sometimes also possible to determine the type of mechanical valve, especially in the mitral valve position, in other words, bileaflet versus tilting disc. However, it can be difficult, if not impossible, to detect a homo, auto, or stentless valve with the help of 2D echo. Complications of prosthetic valves are not so rare. They occur with a frequency of approximately 2 to 3% per patient year. Complications include left ventricular failure, especially if patients are operated too late, mitral regurgitation, either paravalvular, caused by leaks, or valvular, for example in degenerative disease of biological valves, obstruction, caused either by thrombus, barpanus, or as a consequence of degenerative disease, mechanical failure, which however is very rare, and endocarditis. 2D imaging is extremely important in the assessment of valvular function. Often we have to use atypical views simply because we have shadowing caused by the prosthetic material. In addition, we use Doppler, color Doppler, and conventional Doppler, where we quantify the gradients and use the pressure half-time method to detect valvular obstruction and regurgitation. In many cases, we need an additional imaging modality, namely transesophageal echocardiography. Other potential but rare complications include pseudoaneurysms, which are pulsatile cavities often found in combination or in the setting of prosthetic valve endocarditis, iatrogenic ventricular septal defects, and fistulous communications with other chambers. And when you perform echocardiography, it's important to also watch out for other things such as left ventricular function, the severity of associated tricuspid regurgitation, and systolic pulmonary artery pressure. In mitral valve surgery, repair should be favored over replacement. If repair is performed, it is almost always associated with annuloplasty, in other words, implantation of a mitral ring. The most commonly used technique for mitral valve repair, especially of the posterior leaflet, is quadrangular resection and sliding plasty. Complications of mitral valve repair include residual mitral regurgitation, left ventricular inflow and outflow obstruction, and finally endocarditis.